Estimating the prevalence and severity of isolated small-angle strabismic amblyopia from the Alaska Blind Child Discovery. Vision screening is needed for early detection of amblyopia risk factors that are not obvious. Amblyopia is caused by risk factors: refractive error, strabismus, and deprivation like cataracts. About half of amblyopia is due to refractive error that can be photoscreened. About 1/3 of amblyopia is due to strabismus. Large angle strabismus can be detected by parents and pediatricians, but small angle strabismus can hide and cause vision impairment. The prevalence and severity of isolated, non-refractive, small angle strabismic amblyopia are not known. Therefore, we reviewed epidemiological data from large pediatric screening studies in America and also compared it with multi-center amblyopia study recruitment. Then we gathered consecutive cases of positive Bruckner test confirmatory examinations over more than 2 decades, and we utilized Alaska population and vision screening experience data to estimate prevalence in Alaska. This Venn diagram will look for that isolated strabismic amblyopia. Amblyopia has risk factors: refractive error and strabismus. And not all those cause amblyopia, but for amblyopia less than 20/40 vision, refractive error is around 15 to 20% risk factors, and strabismus is only about 4%, whereas amblyopia itself is about 2.5%. For amblyopia due to refractive error, that's about 40% of amblyopia. Due to strabismus alone, about 1/3, and mixed both of those, about less than 30%. A small amount of amblyopia is due to deprivation. For small angle strabismus that is not easy to see, some of those are intermittent and less likely to cause amblyopia, and others are constant. So here's small angle isolated strabismus and strabismic amblyopia. Some of those may be associated with very bad amblyopia or eccentric fixation. So taking from multi-ethnic pediatric eye disease group and Baltimore pediatric eye disease group, the cases of all strabismus, cumulative, adding up to those with a large angle, up to 40 prism diopters, have a cumulative prevalence about this, as many as a little more than 2.5%, down to low amounts for small angle. Constant strabismus is significantly less, and strabismic amblyopia is smaller than that. If we do want to estimate the lowest amounts, this is an estimation. The estimation is better for all strabismus and somewhat fuzzy for constant strabismus isolated and strabismic amblyopia. So we look at a prevalence here of constant strabismus, perhaps less than 1 in 200, and of strabismic amblyopia, less than 1 in 400. We used the enhanced Bruckner test in our clinical practice, and I as a physician used it consistently since early 90s, identifying patients with non-refractive Bruckner test. These were hard to find to get pictures for this paper. Therefore, I looked carefully at all cases of Bruckner test due to small angle strabismus without refractive error. And I kept digital image of those since 2003. So we used many devices to look for Bruckner test over time, developing some that became effective photo screeners. The Canon TX1 was excellent. Also, the Adaptica 2-Win with corneal reflex infrared wand. And then two brilliant friends, Dave Guyton and Dave Hunter, came up with a portable birefringent scanner. The Bruckner test in Alaska from 2003 to 2025 found 34 cases. Amblyopia was present in 9. The detection methods that we used, several different devices with screening results, particularly the Rebion blink. So in Alaska, over this more than 2 decades, isolated small angle strabismus itself and isolated small angle strabismic amblyopia. The Bruckner images, we had 34 patients and 9 with amblyopia worse than 20/40, less than 20 prism diopters, and those less than 15 prism diopters, 23 and 8 with amblyopia worse than 20/40. In children in Alaska, there's about 10,000 born per year, 2 to 3 pediatric ophthalmologists during this period of time. Referral efficiency was probably better for small angle amblyopia in older kids than those with small angles and normal vision. Therefore, we estimate the prevalence in Alaska as approximately 1 in 700 cases have isolated small angle strabismus, less than 20 prism diopters, or about 1 in 1,000, less than 15 prism diopters, while isolated small angle strabismic amblyopia is about 1 in 7,000 cases, less than 20 prism diopters, and 1 in 8,000 cases, less than 15 prism diopters. Therefore, we can add to our cumulative prevalence graph from Alaska Bruckner's test. Here are cases with isolated small angle strabismus, about 1 in 700, and isolated small angle strabismic amblyopia, about 1 in 7,000 cases. In conclusion, isolated small angle strabismic amblyopia appears very rare. Some cases have severe amblyopia that is refractory to late treatment. 4 of our 9 had residual amblyopia worse than 20/40 after treatment. Future vision screeners, therefore, should have very high specificity and should be designed to work with infants and toddlers. The good news is that current photorefractive screeners are still cost-effective with specific instrument referral criteria early, since isolated small angle strabismic amblyopia is so rare. Thank you.